Sexually Transmitted Infections in the United States and South Africa by Nick Houghton. So, in this slide, I'm going to be talking about sexually transmitted infections. And sexually transmitted infections are infections that you can receive by having sexual intercourse with someone who has infections. And they are usually passed from person to person through vaginal intercourse, but they can also be transferred through anal sex, oral sex, or skin to skin contact. Sexually transmitted infections can be caused by viruses or bacteria. Sexually transmitted infections caused by viruses include hepatitis B, herpes, HIV, and the human papillomavirus. Sexually transmitted infections caused by bacteria include chlamydia, gonorrhea, and syphilis. On this slide, I'm going to be talking about the risk factors because there are a lot of risk factors that are associated with sexually transmitted infections. The first one being unprotected sex, because when you're having sex with someone and you don't use a condom or any form of contraception, it increases your risk of receiving a sexually transmitted infection. Another risk factor is sexual contact with multiple people. You know, if you're going around at parties, having sex with multiple people, that also increases your chances of getting a sexually transmitted infection because a lot of times you might not have a condom or you're just doing it just to do it and someone might not tell you or someone might not know that they have a sexually transmitted infection, which is an extreme increase of risk. Your history is a big part of it because if you have an STI, it can make it easier for someone to get that STI that you have. You never want to be in this situation, but being forced to have sex or being forced to do any type of sexual activity. Rape can be something that can cause you to get an STI because you're being forced to have sex and you don't know what the person has, or they're just doing it to give it to you, or something like that. Alcohol or recreational drugs are a big factor um, because when you're under the influence, a lot of the times it makes your decision making not the smartest, and you're more likely to participate in risky behavior. And injecting drugs, heroin, stuff like that. By injecting drugs, you need a needle. And a lot of times people are reusing needles, which that's just that's a leading cause of HIV and hepatitis B and C because a lot of times those needles aren't cleaned and people are just using them over and over again. And another one is young age because a lot of times people in the ages of 15 to 24 are kind of sex crazy and they're just going out and having fun and participating in risky behavior. And a lot of times people aren't going to be equipped with the right facilities like condoms or any contraception. So a lot of times they're going to do it anyway because leading back to alcohol or recreational drugs. In a party setting, you're probably drunk, and some people use drugs at parties. So you're obviously not going to be in the right mindset, and you'll be more likely to participate in those risky behaviors. Demographics of sexually transmitted infections affecting women. Chlamydia and gonorrhea, left untreated, raise the risk of chronic pelvic pain and life-threatening ectopic pregnancy. Chlamydia and gonorrhea also can cause infertility. Untreated syphilis in pregnant women results in infant death up to 40% of the time, which is never a good thing because a lot of times you might not know you have it, and whether you're married or have a boyfriend or trying to get pregnant and you don't have it or you don't know you have it, when you're giving birth, that increases the risk of your baby dying, which is never a good thing. And women have a higher risk than men of getting an STI during unprotected vaginal sex. Um, the reason for this is because men, their penis is covered. I mean, there's only really a little hole in the tip, but it's all skin. And women, the penis is inserted in the vagina, and it's basically breaking a barrier because inside the vagina it's very susceptible to receiving infections, um, and men not so much. Even though men still do get it, it is more prevalent in women that they get an STI over men. Unprotected anal sex puts women at an even more risk for getting an STI than unprotected vaginal sex. The cause for this is because there's a lot more bacteria and nasty stuff because that's where you poop out of. But definitely more or increased risk for getting an STI than unprotected vaginal sex. On this slide, I'm going to be talking about the demographics of the United States. In 2018, sexually transmitted infection reached an all-time high in the United States. The number of combined cases of gonorrhea, syphilis, and chlamydia was more than 2.4 million in 2018, which is up from 1.8 million in 2013. That's in 5 years, that is an insane increase in sexually transmitted infections, which I also feel like it has to do with the culture. The culture changes a lot from generation to generation, and a lot of the younger people are more into trying more risky things, I would say. Um, Young people also, when they go out to parties and they're around a lot more people and a lot of sexual activity is going on. Um, but while these STIs have grown considerably over the past 5 years, the human papillomavirus remains the most commonly sexually transmitted infections in the United States, with 79 million Americans infected, most in their late teens and early 20s, which is also back to the fact that I was talking about a lot of younger people. Um, they're into more risky behaviors, and I feel like the party life is a lot more crazy now, and people are getting more drunk, um, and doing things that they probably wouldn't do when they're sober, which has to do extremely big factor in that. Um, on this slide, I'm going to be talking about the demographics of South Africa. In South Africa, it has a generalized HIV and STI epidemic that ranks amongst the highest in the world. HIV prevalence is estimated to be 17.8% of reproductive age, and the percent of condom use was low among all ages and around the same percent, which I can understand. I feel like a lot of people they kind of like to ditch the condom route and just go unprotected, which is probably one of the bigger causes of why these sexually transmitted infections are spreading as much as they are. Um, Definitely need to start using more condoms. Unprotected sex is just too risky because you never know what someone might have or someone might not know that they have. And older women are more likely to be infected with HIV. So, on this slide, I'm going to be comparing the United States and South Africa. And the United States is obviously much longer or larger than South Africa, which has to do a lot with this sexually transmitted infections. I feel like there's more people in America, um, which is more susceptible for spreading sexually transmitted infections. Um, but in South Africa, HIV is definitely the most prevalent sexually transmitted infection. And in the United States, HIV is definitely less prevalent. It's more of like gonorrhea and syphilis and hepatitis and the United States and South Africa are both reaching all-time highs when it comes to sexually transmitted infections. And this you could go back to a couple slides ago when I mentioned that um, a lot of the younger people or the younger generations are starting to get into things much earlier. Um, Definitely starting sex at a much younger age. And I feel like the party scene and in high school, the party scene is starting to get into a younger age as well, which is leading younger people to go down the wrong path and participate in the risky sexual behaviors. Some even before they even learn about sex ed, which is a big problem because they don't know what they're getting into. And a lot of teen pregnancies are becoming a big problem as well. Um, so people really don't know anything about sexually transmitted infections because they're so young at this point. Um, but I feel like both of these countries have a big problem when it comes to that, just because they're not practicing safe sex um, or doing much to prevent these things from happening, which is definitely a huge cause. So, on this slide, I'm going to be talking about treatment and screenings. I mean, most of the time with the sexually transmitted infections, there's going to be a lot of signs and symptoms that you have a sexually transmitted infection. And there are a few things that you can do. You can get a blood test where they take your blood and test it to see if you have any sexually transmitted infections. One of the more common ones is a urine sample. I know at colleges and stuff they do that a lot more often than blood tests, unless they have suspicions that it's something that requires a blood test. And there are also fluid samples. There are different types of screenings based on age, because a lot of the screenings that have to do with age, there's time periods of when people were being born that were more susceptible of receiving like hepatitis or human papilloma virus. When you're pregnant, there's a different type of screening because you want to definitely make sure that your baby is going to have the healthiest birth. Um, and if you don't know if you have a sexually transmitted infection, that could definitely put your baby at a risk for potential death. Women 21 and older, um, because that's the time when you're usually like mostly sexually active because people are going to bars, you're trying to find out who you want to marry, and then start a family with. And women under 25 who are sexually active, especially the teenage years, because people are definitely having sex at a much younger age and they need to be aware of what they're getting themselves into. I know at colleges, a lot of the times they offer free sexually or STD testing and STI testing because obviously on a college campus there's a lot of sexual activity going around, and to ensure the safety and smartness of students, that I think a free STI and STD test is definitely a very good thing that they are doing at schools now at the health centers. Um, People with HIV also need to be tested as well. And definitely, as you're going through the relationship stages in college and whenever, when you have a new partner, you want to get tested because you don't know what you might have or what they might have. It's just safer that you and your partner go get tested just to make sure that um, nothing's going on and be having the safest sex as possible. And there are two types of treatment. You can do antibiotics and antiviral drugs. Um, Sexually transmitted infections are curable if you catch them at the right stages. If they get really, really bad, it's a little harder to get rid of. But like herpes and stuff like that, that's a lifetime thing. It's really hard to cure that. So, summary and conclusion is what I'm going to be talking about on this slide. And I think sexually transmitted infections are extremely prevalent around the world. And we have to do everything we can to prevent sexually transmitted infections from spreading because they make people's lives much more difficult. Especially when you're at a younger age, if you have one, it it causes problems when trying to date someone or if you really like someone because you have to tell them if you have a sexually transmitted infection because they could receive it as well if you don't, and you could get in very big trouble. But it makes it definitely more difficult to deal with because a lot of people aren't as accepting. Um, and if you do tell them that, they probably won't date you because you're still at a young age, and that's just not something that a lot of people want to deal with at the time. And a lot of the reason these sexually transmitted infections spread like wildfires are because people don't practice safe sex like they should be to make sure that sexually transmitted infections are stopped as best as they can. And that brings it back to a couple slides ago where I talked about alcohol. Um, a lot of people don't make smart choices when they're under the influence. Even when they're not under the influence, people tend to shy away from contraception and practicing safe sex because they think it's cool. Practicing safe sex is definitely cool because why would you want to live the rest of your life with a sexually transmitted infection or disease? Because that honestly could ruin your life in certain ways. And definitely different cultures have different sexual acts and preferences that can cause certain sexually transmitted infections to spread. Um, it's the same thing in every different country. Um, in one country, people might like doing a certain thing. In another country, um, whatever they do in that one country might not be acceptable, or they might think that's weird. Cultures are different. Different cultures like different things, and that is the reason why there are different sexually transmitted infections that spread more in different countries. Um, but definitely sexually transmitted infections are a extremely prevalent thing in life, and we need to do whatever we can to make sure that they don't spread. Um, do what you can to make sure that you're practicing safe sex. And if someone that you want to have sex with or wants to have sex with you doesn't really want to have safe sex, you might want to shy away from that um, because that does put you at a higher risk of receiving a sexually transmitted infection, which could ruin your life. Um, as your parents always say, use a condom, use a condom, use a condom. Because they know, they're old, they're educated. Um, I know younger ages are educated as well, but a lot of people like to ignore the fact that that's what they're taught and just do what they want to do anyway. But that's my presentation, and that's my summary and conclusion, and thank you very much.